Well, good morning, everyone. Thanks for attending this morning's webinar. My name is Christy Strauss, and I'm one of the broker sales managers here at IAD. We are pleased to have you to talk about Priority Health this morning. So many of you have actually attended our sales summit, and you were there to hear the presentation of the Priority Health rollout. Many of you have done a face-to-face already with them, and so you already have an idea of what their product looks like. So this is going to be sort of a repeat, but at a much higher level. I'm not going to get too much into the weeds on a lot of this stuff, but really from a sales perspective, why I believe you should be appointed and offering Priority Health this year. They're really knocking it out of the park, and you'll get a second chance to take a good look at that. I want to just mention for those who are not familiar with who IAD is, we are a full-service FMO that pride ourselves on simplifying our agents' success. And how we do that is by using 7 different pillars that support your success. I'm just going to name them off briefly. You all that know IAD are familiar with that. We have product offering, national contracted with many carriers, over 45 to mention, 15 different product lines. And we find that although our senior market health and life is where our specialty lies, agents do some cross-selling, and so going across those just lines to different types of products is very important. We also have training and education, webinars ongoing, live sales summits and road shows. We also have a YouTube library where we house our recorded webinars. And then marketing services available to you. Sales tools is another one of our pillars, and we use sort of a turnkey selling system for many of the product lines. We also have a lead generation and lead programs available to agents. Pretty much we can customize them to your needs, but we do follow a few hard, fast rules, and talk to me about that afterwards. Technology. We have a new website, and it's getting more robust. We're building it with even more critical features that the agents are going to need, and we have the opportunity to work with agents and help them build a website with our Medicare Sales Pro. Also, our first-in-class admin services. If any of you have spoken with Heather before, you know how awesome she is. She's not just pleasant, she is extremely knowledgeable, and we're really lucky to have her here with us on our staff. So just a few housekeeping questions. Everybody is muted, as I mentioned, and so you can type some answers. I'll hold those answers till the end of the webinar. And this webinar is recorded, so it will be in our YouTube library within about a week. So by this time next week, we should have it there. And you can see my contact information on this current slide. So let's get going. Here we go. Top reasons to sell Priority Health. As I mentioned, I'm excited about Priority Health this year for a lot of reasons. The first reason is they're going full out with their commission, unlike prior years. So that's a big reason for you agents. But another big reason for you agents is their products are they're really stellar. Low premiums, no in-network medical deductibles. Again, that's in-network. Supplemental benefits that members can use, the dental, the vision, the hearing, the over-the-counter allowances that they have. All of the MA plans are offering these over-the-counter allowances, so it's nice. But theirs is unique, and I'll go into a few more details on it as we get closer to the next slide. So Priority Health has a huge footprint in the state of Michigan. They over 97% of all providers are in their network. That's awesome. The other thing they have right now, and this right here, number 2, this is one of the other reasons you want to sell this plan. You've got folks that need the low-cost MA plans, but they still go outside of the state in warmer climates or just to visit their children or grandchildren in different states. The minute they leave the state, they have to leave Michigan, but the minute they leave Michigan, they're going to take care of their out-of-network costs. They're going to bill them as if they are in-network, and that's incredible. So keep that in mind for your clients if they are traveling. This is a great plan to have. Unlimited worldwide emergency and urgent care is another thing that's baked into these plans. So, just a few little things here. No medical deductible, why they recognize that value. I'm not going to go into every one of these things, but free to talk, I believe this or not, I found it hard to believe, but if you go in for your physical, and if you're like me, you're like, well, I'm not going to go to the doctor to complain about a minor back pain I've been having. I'll just talk about it at my physical. I did not realize that those are also billed out separately on top of your physical. And so what seniors are noticing, they might be doing this as well. Now they can have the ability free to talk. And if they go for their physical, they can list out whatever it is that they're dealing with and not have to worry about additional costs on that. So the out-of-state travel benefit, in-network copays and out-of-network copays. So Medicare participating providers in all the states. But again, keep in mind, it doesn't include Michigan. They have to see their network providers in the state of Michigan. So this only is going to get triggered when they should go outside of Michigan and they need care. So that's what's going to be really critical. They have a very awesome customer service, and my understanding is more to come. Their customer service is even going to step it up a notch more. So I think we're going to see something like, and I hate to use another carrier, I'm not going to name them, they have a department that you can call in and they'll help you with if somebody's qualifying for low-income subsidy or if they're dual eligible and that sort of thing. They're going to ramp it up and develop something like that for Priority Health, which is awesome. You probably know why they're going to do that here. Assist America, that includes some emergency travel things like say you're out of the country and there's a hurricane and you need to get out there. This is something that's going to help you also with even translating. So they'll help you with visa requirements and that sort of thing. Over-the-counter allowance. Now, over here on the right side of the screen, you can see how much it is per quarter. So some of the plans have a more robust, but $25 a quarter, that's going to buy Band-Aids, Advil, perhaps even your things like NyQuil or whatever you would use, lozenges or vitamins and that sort of thing as we enter the winter months. I know I like to stock up on that kind of thing. But this is where it's a little different. There's going to be sort of a debit card looking type thing that you can use to go to Walmart, CVS, or Kroger and buy your over-the-counter supplies. Now, let's just say you wanted to also throw in, a couple of items of produce in that. So long as you have spent $35, you can actually throw that in on that debit card. So let me see here. It looks like somebody has asked a question, but for some reason, I'm going to hold it till the end if you don't mind, and I'll get back to that. So hold your question here. And so that is, just a very valuable, I guess, benefit and perk to have this particular card on the event you need to maybe buy even a birthday card or something. Now, if you go to Walmart.com and you don't want to travel, or perhaps you can't, you can also do the same thing. You'll need to spend at least the $35, and then perhaps you've got a little bit more left on that card. You can go ahead and add in a few other items that are needed. So hopefully that makes sense, but ask me more, and I'll assist you when I get through this. Their dental network is powered by Delta Dental, and I will tell you, my daughter works in the dental field, and she said this is bar none the best insurance, the Delta Dental, that they never have a problem. Not any dentist she's ever worked for. So it's I would guess, a premium carrier for the dental insurance. So that's really awesome. Now, it's including and baked into the plans 2 cleanings, so twice a year, and that's what's recommended. And that's also including the periodontal cleanings. Most folks, once they hit 65, are getting some sort of periodontal or having periodontal issues. So that's really important, and I believe that's why they bake that in there this time, is to provide that, because it's kind of a pain if you're going for a cleaning and you need to get this, and that's an upcharge. It's also including the X-ray, the panoramic, which dentists like to do at least every year or 2 years. So it is going to cover that full cost. Vision is powered by iMed, and so it's a $0 routine vision exam baked into that plan. They're going to give you a $100 eyewear allowance. That could be for glasses or contacts. And then the retinal screening and the retinal imaging exam. So that's a yearly exam that's very important for all of us. As we age, our eye health is important. And then hearing, true hearing. You can see they've tiered out it's going to be just true copays. So, for the lower level hearing aids would be a copay of $295, all the way up to the higher level, or that one of the highest levels of the hearing aids, which would be $1495. They're going to fit you and do an eval and give you batteries also. So that's, for ones that have had to go through this process, it is pretty important and can be quite costly. Cutting edge here, this is new. Grandkids for Hire. This pop-up Pals isn't new, but it's new because it's baked into the plan. But it's important to know this. It is going to require an in-home assessment before one can use it. So, it's 8 hours that they're going to be able to allow each beneficiary to use per month, so you might want to divide that up. Perhaps somebody needs a little bit of respite care and maybe a 4-hour stint just twice a month. That would be something they could come in and just sit around with them, just companionship. Or you could break it down into even 1-hour intervals and have them come in and do household chores or transportation or even meal preps. So that's an awesome component, but keep in mind it is going to require that in-home assessment. And so make sure you're communicating that to your clients. The fitness benefit. So they transitioned over to silver sneakers for 2020. There's a multitude of facilities, 480 plus in Michigan. And so you can, go from Anytime Fitness or Planet Fitness to, the Y. And, you don't have to just stick in one. So if you're visiting your kids who live in Traverse City or in a different area, they might have different types of gyms. So you can do that. They also allow for that at-home video or DVD. I was going to say video DVDs to just be able to do some exercises in your home. Now this College Save Rewards, this intrigued me. I don't know if it got you all, but it did intrigue me. And I'm telling you what, I hope it sticks around because I can't wait to get on this and be able to help my grandchildren. From what I understand, and I don't have a ton of information, but I do have a piece. You have to register with the Silver Sneakers. They have a separate online registration, and you would probably fill out who your carrier is and that sort of thing. I believe Humana is also a part of this, and I don't want to misspeak, so I don't want to say anybody else. But basically, once you register, you get 1,000 points, which converts to $1,000. And then each time you go to the gym, a minimum of 7 visits per month, which sounds like a lot. Maybe it is for a senior, but it really isn't. Keeps them healthy, active, or even just social if that's all you're going for. Then you get an extra 250 of those points transferred into $250. So at the end of the year, you're looking at about $4,000. And that website, and I can send you all more information, will provide you with the list of universities and colleges that cooperate in this. So you can transfer that to a specific grandchild, or I'm not sure if you can split it up amongst many of your grandchildren. I have 7, so that's going to be crazy. But in any event, you can transfer those points as tuition dollars. So I'm so excited about that. I think that's great. Each one of these slides, and I'm not going to go into too much detail. I'm going to sort of buzz through each one of these. You are all very familiar with that Priority has several different plans. They have a PPO plan, zero premium one. They have a POS plan, zero premium. The reason I'm buzzing through this is I want to get to the thing that I think is one of the main reasons you should be offering Priority Health this year. And so then another PPO, a little bit richer, $14 or $18, depending on your county. And it will tell you what's baked into the plan. Some have a lot of different things. This is the value POS. And they have a merit PPO. And I want to get to the new one. No, there's another PPO. And, here we go. Here's the reason right now why you need to be offering Priority Health. We've seen statistics introduced to us for the number of dual eligibles in the state, and it's quite high. And those folks don't get communicated to, or they don't have access to this information. So as agents, we have to reach out to them and let them know what they can have for these dual eligibles. Priority Health has a statewide, in the mitten, the entire Lower Peninsula of Michigan, DSNP, and they'll all be using their networks. So I thought to myself, okay, so basically what they're saying is as long as available in all counties in Priority Health Medicare Advantage service areas. So I thought, okay, they're saying they're in the whole state. I'm being a skeptic now. And maybe there's not maybe there's not networking in the whole state. Well, that's where I'm wrong. They do have networks throughout the state, and they can use the same network that any of their other plans use. So that's huge to be able to offer, no matter where they're located in the lower part of the Lower Peninsula of Michigan, an opportunity to have a solid plan, a DSNP HMO. Now, they would not be eligible for that travel benefit. So, just so you know, there are a few things that the DSNPs aren't going to allow, but that is one of them. They have a very rich formulary, obviously for beneficiaries who are 21 years or older who are full benefit dual eligibles. So somebody who's had, been on disability and now have Medicare, those folks are eligible for this. So that is a huge reason. I hope that you all find that to be impactful as well. Ways to save on drugs. They have preferred pharmacies like Meijer, Walgreens, Kroger, and many more. Using those are going to keep you in your preferred pharmacy. You will see a listing of those with your sales kits and that sort of thing. They also have the mail order, the tiers 1 and 2. For the 90-day mail order, it's $0 copay. And you're basically getting 2.5 times that for a 3-month supply. And so as we move on, this is the different plans throughout the state. There are 5 different regions. They're sort of scattered. Like just take, for instance, Region 3. You can see they're scattered around in the northwest corner, a little bit in the middle, and then a couple right here at the very southern tips of the state. So, this is an important map to keep in mind, especially if you're an agent that does travel around the state to offer your clients plans. And with that, I'm going to open it up to questions. So let me see attendee chat. Please feel free to write a question in right now if you should have one. I'm not seeing anybody, and I'm not sure why. I thought I did see some questions, but for whatever reason, I'm not seeing that right now. I'm going to type in, please send me questions. And let's just see if I get a response. Can you all hear me? I want to be sure that. Type something in there. Oh, here we go. Attendee chat. I am getting a question now. DSNP commission, they're giving the full amount, same amount. So that is another reason why this plan is looking just fantastic for this year. It's seriously, a home run. Now, we have other carriers with other sweet spots, so I don't want to discount them, but this webinar is just focusing on priority. So great question. Surprised I didn't mention that in the beginning, but good question. Anybody else? Folks, I won't keep any longer. Like I said, this was a high level. Most of you already know all this good stuff, but I'm telling you right now, this is important to your clients. There are so many reasons to offer priority health this year. I think this is going to be a great AEP. Mostly the consumers just are finally going to get so many nice plans to choose from based on their needs, and you all are great at picking the plans that fit them best. So I'm just going to go ahead and close for today. A little bit of the technology issue. Please email me a question, and as soon as this goes live into the YouTube library, I will email you all a link. Thank you so much for your time today, and you all have a great weekend.